The BASIL 1 trial bypass versus angioplasty for severe leg ischemia. Hey, everyone. Welcome back to the channel. Today we're diving deep into a real game changer in vascular surgery, the BASIL 1 trial. If you've ever wondered how doctors decide between bypass surgery and balloon angioplasty for patients with severely blocked arteries in their legs, this is the episode for you. What was the BASIL 1 trial all about? So, let me set the scene. The BASIL 1 trial, short for bypass versus angioplasty in severe ischemia of the leg, was a multi-center, randomized controlled study out of the UK. Picture this: 452 patients, all struggling with severe limb ischemia, that means rest pain, tissue loss, or even gangrene, and all of them were suitable for either bypass surgery or balloon angioplasty. How were the treatments different? On one side, you've got bypass surgery. Think of it as creating a new pathway around the blockage, using either your own vein or a synthetic graft. On the other, there's balloon angioplasty, where doctors use a tiny balloon to open up clogged arteries from the inside. What did they find? Let's get into the results. First up, amputation-free survival at 6 months. The numbers were super close. 71% for bypass, 70% for angioplasty. Not much of a difference, right? But fast forward to 2 years, and bypass starts to pull ahead, with 57% versus 52%. Still, the difference wasn't statistically significant, p equals 0.08. But here's where it gets interesting. For patients who lived longer than 2 years, bypass surgery came out on top. The median survival was nearly 6 years for bypass, compared to just 3.5 years for angioplasty, p equals 0.02. The cost factor now. Let's talk dollars and cents. Angioplasty was more cost-effective in the short term, but bypass gave you more bang for your buck long term. Better durability, fewer reinterventions down the line, complications and considerations of course. Every treatment has its trade-offs. Bypass had a higher risk of complications early on, like wound infections. Angioplasty, meanwhile, led to more repeat procedures. What does it all mean? Here's the big takeaway. If you're a frail patient or have a limited life expectancy, angioplasty might be the way to go for short-term relief. But if you're younger and healthier, bypass surgery could offer better long-term outcomes. This trial really shifted the paradigm. It encouraged doctors to tailor treatment. Angioplasty first for high-risk folks, and bypass for those who can handle it and want a longer-term fix. In fact, this approach influenced major guidelines, like those from ESVS and ACCAHA. So, next time you hear about bypass or angioplasty for limb ischemia, you'll know that thanks to the BASIL 1 trial, it's all about picking the right option for the right patient. If you found this breakdown helpful, don't forget to like, subscribe, and share with someone who might benefit from this info. Catch you next time on the Everything Surgery podcast. Dissect the extraordinary.